Alright guys, welcome to First Aid for Paddlers. Today we want to talk about concussions. My name is Brett Burns. I have been an advanced EMT for 14 years now, practicing. And this is...
Hi, I'm Nick Burns, Brett's dad, Whitewater enthusiast. I've been an advanced EMT for 32 years or so. I also work in a local ER.
Big problem with concussions is that they're pretty hard to diagnose unless you're a doctor. Also, there isn't really anything that you can do for it except do your best to prevent it. So hopefully if you're in a situation where you can get a concussion, where you can't hit your head, hopefully you are wearing a helmet in most of these situations. However, if you're not, we kind of want to go over the different kind of signs and symptoms of a concussion and which ones are, more significant than others, and which ones might make you want to go seek medical attention.
First thing that happens after a concussion, not a lot of people, not all, but is nausea and vomiting. If you have vomiting after a concussion or after a head strike, it's considered bad, obviously, but if you have more than one bout of nausea and vomiting, you might want to get checked out by a medical professional after that. Generally, a head strike with one bout of vomiting isn't considered the worst of things. Next thing is dilated pupils. Very frequently, if you check whoever you're with to see if their pupils are dilated because of a head strike, you'll find that if they do have a concussion, their pupils are dilated. Amnesia from the event. They don't remember what happened. They don't remember how it happened. Big question is, did you get knocked out? Yes, no. If you did get knocked out, higher chance of having a possible concussion. Next is repetitive questioning. Many years on the ambulance, I've seen people who just keep asking the same question over and over again. That's just a somewhat common thing for a pretty severe concussion.
This is one of the more scary things to see, in my opinion. Having that person, asking you the same question over and over again, you just answered that question. It's kind of scary, and it is kind of concerning. However, I would say it's a fairly common sign of a decent concussion. Yes. And I wouldn't say any more scary than any other symptom.
Yeah. Next one after that is going to be headache. You're going to have a headache for a long period of time. It'll come and go, but you'll still be on and off for that headache. Post-concussion syndrome, what that is all the signs and symptoms you had from the concussion brought on from day one to 1 year after. And it's common for people to have multiple concussions through their life. The more you've had, the more likely you are to have this post-concussion syndrome. What do we do about a concussion? Treat the symptoms. Easiest thing to do, Tylenol for a headache, stuff like that, whatever you use for over-the-counter medications. But the next important thing is don't be driving. No screen time. Put the cell phone down, put the laptop down. As little screen time as possible helps the brain heal with as less stimuli as possible.
And no blood thinners.
If you're on a blood thinner, you have a head strike, you should go see a doctor immediately.
Advil?
Advil, Tylenol, Motrin, whatever your over-the-counter medication is of preference, use what you always use.
Alright guys, I am Brett and this is Nick from Whitewater. Thank you guys for watching today. Have a good rest of your day.